Hello and good morning. We're going to get started in just a few minutes as everyone gets logged in. Hello and welcome. Thank you to everyone who is joining us now. It looks like we're ready to get started. So I'm going to go ahead and stop my screen share and kick it over to our speakers to begin. So go ahead, speakers, and turn on your cameras and mics and we'll get started. Thank you so much.
Great, thank you. Hello, everyone, and welcome. I'm Jen Faust, and I'm really proud to be included in this important session today, representing my own organization, the Pacific Council on International Policy, as its executive director. It's really hard to imagine a more significant discussion than what you will take part in here with our excellent panelists. Today, we're talking about a just recovery. The global pandemic has brought glaring light to inequities in our global systems, specifically our healthcare, our economic systems, and thirdly, access to justice. As you heard from Kristen in the opening plenary this morning, what better time than now to reset and reimagine a better and more equitable future? Let's not build back to the status quo. Let us make our 2021 decisions around the fundamental aspects of human rights, justice, and equity, and this will help ensure a just recovery. As we get started, may I request that each of you in the audience go into the chat feature right now and type your name and affiliation and just say hello to everyone. While this is happening, let me share how the session will go today as regards to format. So you'll hear me speaking with our panelists and talking through a variety of different questions with them. And then after some good stimulus material is out there for all of you, we'll switch to Q&A from the audience. And at that time, I'll prompt each of you to enter your questions in the chat, in the Q&A tab at the bottom of your screen. So let me direct you to that. At the bottom of your screen, you'll see the Q&A tab. Hold tight for now, hold tight for about 30 minutes before putting in your questions if you can, just so you can see if any of our speakers answer the questions that you have as they're talking. So here we go. Please welcome our phenomenal panel, and please, if you have not already, do go and check out their bios in the WOVA Act. The full bios are listed there. First, we have Carla Blauvelt, Director of Programs at VillageReach. Irit Tamir is the Director of Private Sector Development at Oxfam in America. Ted Piccone is the Chief Engagement Officer at World Justice Project. Welcome, everyone. It is really such a joy to be here with you. To each of you in turn, I want to ask you one overarching question, and we'll go in order starting with Carla. So here's the question, Carla. In many ways, the pandemic has exacerbated the already existing inequities and power imbalances across the globe. We have also have a moment in time when people are re-examining and questioning the status quo. Can you give us your take? What can you tell us about what you've observed related to increased awareness of inequalities in the global system? Over to you, Carla.
Thank you so much for allowing me to speak here today. Yes, I do believe that there's been an increased awareness of inequalities, including inequalities among individuals, as well as macro level inequalities. So in other words, the power imbalances that really impact the entire space of development. In our work, we've always known that these exist and that there are significant inequalities, and these show up due to race, class, but also geography and amongst vulnerable populations, migrant populations, etc. And so this awareness is really helpful in having difficult conversations with our staff, with our partners, and particularly with our donors. And we're really trying to use this moment now to reflect on where we are now and the direction we're trying to go so that we can hit these systemic issues head on. And these systemic issues can include decolonizing development, infrastructure inequities at the last mile, which will affect the vaccine rollout, and many others. But given the time frame that we have, I'll just focus on decolonizing development. So as a result of the attention on systemic inequalities, global health and development actors have really begun to have conversations about what that means, what decolonization means for our field. And so for making these micro shifts in our work towards decolonizing development, we as VillageReach, other NGOs, governments, and even donors are really trying to see how we can address those power imbalances. So how do we switch the dynamic of development being really pushed by NGOs and donors to one in which the governments and the people benefiting from the services are really the ones driving the changes that are most important to them? So I'll give an example from in Malawi, which is where I work. An international NGO had developed a digital health solution, which is a great solution, and they rolled it out in roughly half the country. Then a large donor-funded project came in, and another NGO ran a almost identical digital health solution in the other half of the country. At the end of the day, neither one of those were built into the government system, and the systems themselves didn't speak, so the government couldn't use the data. So ultimately, it wasted both resources and energy. And so to us, decolonizing development really is about putting the government in the driver's seat, as they should be. And that's really the only viable way to strengthen health systems in countries where the public sector is the main primary way of accessing health services. So some changes we've made in VillageReach are that we're really looking at, when we used to fly in international experts to provide technical assistance, we're instead looking at developing the capacity of local innovators, or better yet, identifying that local innovators do exist and helping them build up their innovations in the countries and expand those beyond. And we're also looking at having technical assistance go from being the elite to the elite, then trickle down to the communities, to one in which the communities are really worked with directly and the citizens are worked with directly to understand how to best meet their needs. So in all of these reflections, we're trying to own up to the fact that we really need to flip those power dynamics. Governments in low and middle income countries are raising this. And finally, in this moment in time, we're actually listening and trying to shift our approach. So while I think people are more aware of the inequalities, and as a global community, we're really making strides in that direction, there's really still a lot to be done to ensure that the most vulnerable are reached. Thank you.
That's a lot for us to think about, Carla. Thank you. Irit, give us your take. What do you think about the increased awareness around inequalities in the global system?
Great, thank you so much. And thanks to Global Washington for having me here today. Just very quickly, Oxfam America is part of a global confederation that works to end the injustice of poverty and more the injustice of inequality. And I was asked to speak specifically about how we reduce inequalities in relation to SDG 10. And we absolutely think that the pandemic has increased the awareness of inequalities because it has really uncovered and accelerated economic inequalities in a way that we haven't seen before, such that it has led to 400 million jobs lost, according to the ILO, even as we see stock markets and global multinational companies continue to outperform, widening the gap between working families and the rich. Only 4 of the richest 50 billionaires saw their fortunes decrease during the pandemic, and 178 new billionaires were actually created since March when the pandemic started. Yet the poor are continuing to get poorer, and estimates are that 200 million to as many as 500 million people could become more impoverished as a result of the pandemic. Many of these are informal workers without any social protection and are not covered by any labor laws. They are disproportionately women, people of color, and indigenous communities. And just to give one example of this, 740 million women work in the informal economy, and during the first month of the pandemic, saw their income fall by 60%. So this is just one way in which we are seeing how inequalities are exacerbated during this pandemic as a result there, and maybe bring some other examples later in the conversation.
Okay, that's great. Yes, it's really interesting to look at it both from what Carla says about the government sector and supporting that way, and then your take as you look at the private sector and the haves and the have-nots and how that's being exacerbated and the awareness around that. Ted, I know you look at all kinds of things. Share with us what you're seeing in terms of increased awareness around inequalities as a result of the global pandemic.
Sure, thanks, Jen, and I'm happy to be here with Irit and Carla, and all of you who have signed in. You know, I think just to build on the points that were already made, there's no question that there's a greater awareness and visibility of inequalities because it's staring us in the face. I think for so many people in our daily lives, we're seeing the impact on people who are our frontline workers, essential workers, of course, healthcare in particular, but also, you know, the restaurants and grocery stores and delivery drivers, and how more vulnerable they are and exposed they are to this virus. So I think there's so many examples, and both speakers have already identified many of them. I've been thinking about migrant populations in particular because they sit in an intersection of multiple vulnerabilities. Lack of legal identification in many cases. They're on the move, so they're more exposed to the virus. They are more likely to be in the informal economy, which means they don't have labor protections, don't have access to unemployment insurance. I'm also thinking about, you know, parents with children and the inability for them to send their children to school in many places around the world. And we're now seeing the reports come out of what impact that's having on learning. And not surprisingly, including in this country, those that are more disadvantaged, lower income, minorities are falling further behind on the education track. So we have a danger here of falling into, you know, setting us back dramatically after a period of slow but some gains toward the Sustainable Development Goals. So I think we have to really focus on what affirmative steps need to be taken now that we're building a just recovery. And obviously there's some things around you know, access to justice and to public services, and making it more equitable. Our unemployment insurance system is antiquated and needs an overhaul. I mentioned, you know, the need for access to schools, and putting more people into the formal labor system so they have, and getting them legal identity. Another issue for expanding access to legal representation, there needs to be a greater investment in legal aid across the board, and maybe some flexibility around legal advice, you know, licensing paralegals. The state of Utah has begun moving in that direction so that there is easier access to legal advice. And another way to do that is to embed legal services in health clinics and in other public services. And we've seen projects like that in Alaska, in other parts of the world where that integration has been meaningful. Couple of other points if I have time. One is that when people don't have access to justice, it adversely affects their lives in lots of different ways. I mean, their everyday legal problems around debt and money and housing, if they're not resolved effectively and efficiently, then people have health problems, people lose jobs, they lose their housing, and their inequality gets worse. So I think that we've seen through our surveys of populations in over 100 countries, that connection between lack of access to justice and impacts on and setting them back on their own journey out of poverty. And then finally, my last point on this is we're seeing through popular protests a greater attention to inequalities here in the United States, but also in countries like Colombia and Nigeria and in Chile, where people, both before and after the pandemic, it was a bit of a pause there for a while, but people returned to the streets from a bottom-up perspective, peacefully protesting against inequality. And I think that's noteworthy. We've seen in our rule of law index how over the last 5 years, there's been a steady deterioration in respect for fundamental rights. So I wanted to put a flag on how important it is that we pay attention to the infrastructure that we need in order for people to actually have a voice in a more just and inclusive recovery.
Okay, Ted, you've really thrown down the gauntlet for us. There's a lot of calls to action in there. Carla and Irit and Ted, you've all identified this widening gap between people who have more access to some of these systems and people who are blocked out because of systemic reasons. I think we'll have some opportunity to drill into perhaps some of the solutions that you might see from your angles. And let's start with you, Carla. As you said, VillageReach delivers healthcare to the last mile. That's an important place to be in remote Africa. So what have you seen in terms of healthcare access and equity for those really vulnerable during the pandemic? And what can you tell us about the systemic need for change that you've already identified through your work?
Thank you for your question. So we think about access as both access to products and access to services, and that includes access to information. So we talk about access to products, it means not just the medicines and medical supplies being available in the country, but that the people who need those medicines, so the patients and the medical supplies, the healthcare workers, are able to receive and use them when and where they need them, no matter where they are in the country. So for many countries, the people delivering those services and medicines are at the last mile, are the community healthcare workers. But because of the massive PPE challenges and supply chain challenges, many of those were left without any protection and still had to choose between doing their job and serving others and protecting themselves. And so 2 Malawian CHWs called health surveillance assistants in Malawi said, we're very passionate about our work, about serving our community, and we provide care and support so that people do not die from unnecessary deaths, even at the expense of endangering our own lives. And so many people do that, but should they have to? So VillageReach helped provide PPEs to 10,000 HSAs across 28 districts in Malawi through the COVID-19 Action Fund for Africa. And I tell this story because what the pandemic really brings to the center is that in low and middle income countries, much of the primary healthcare is really delivered through these community healthcare workers. They're the ones who go door to door, who deliver vaccines, who are working with people, and people trust them even when they don't trust going to the health facility because they're worried about getting, COVID-19. Yet, when we think about it, really what needs to change at a systems level is how we integrate them as vital members of the health system. So CHWs, while they're doing all this work, most of them are women and they don't have the supplies they need. And also some of them are underpaid or not even paid. And that tells us a lot about how we support the most vulnerable members of the global community. So really what they need are professionalized and institutionalized CHWs who receive regular compensation, who have dedicated supervision, accreditation, and ongoing professional development, because then they'll be better placed to take on the roles that they are already required to do. And so it'll help everyone, not only in this pandemic, but in preventing the next one. And then the other key area is equity to information access is really critical. So whether you're in the rural or urban US or in Mozambique or Malawi, getting reliable, up-to-date information on the virus, on how to protect yourself is really important, and it can be difficult. And misinformation is rampant. And people once trusted sources and now sometimes don't trust those sources. So an example that we found in Mozambique is that 68% of CHWs said that COVID-19 is a disease for the rich, which does not affect the poor. And this is something we're seeing not just in Mozambique, but in many areas of the world. And it shows the need for reliable information, and how that information is disseminated is really important. And those ideas for it don't have to come from the global north. So an example of systemic change is that early on in the pandemic, my father said to me, people are talking in the US about health hotlines and telemedicine as if it's a new thing. And you guys, meaning VillageReach, but more importantly, the Malawi Ministry of Health, have had a health hotline for years. And so what we've been able to learn is that having the government really drive and leverage these existing health hotlines and messaging services can help people access accurate information from their homes. So the Malawi government named the health hotline, Health Center by Phone, their go-to source of information for COVID-19 and other health-related topics. So that means that it leveled the playing field, because people with a basic phone in a rural community could get the same information as those in the capital city. And so this will be really important for creating demand and dispelling misinformation when the vaccine becomes available. So when we think about systems changes, we need to think about equity at multiple levels, but also think about the systems level innovations that can really be leveraged to level the playing field for accurate health information. And ultimately, this is going to serve everyone. It'll better serve everyone. Thank you.
That's really great, Carla. I know you've probably got a lot of people's wheels turning in their head when you start to talk about information and misinformation around health. We've all been experiencing different levels of that, and how it looks from the aspect of VillageReach in the field in Africa, I think relates to what we're all seeing too. So if we don't have questions from the Q&A about that, we'll have to come back to that. But before we do, let me just turn it over to Irit to bring us back to the Oxfam experience. And looking at it from Oxfam, I know you've been working with companies, and you've been studying the issues that relate to inequality, including issues around tax, labor rights, ethical supply chains, and safe working conditions. That's a big portfolio. What are you seeing during the pandemic as it applies to global companies and the issue of inequality?
Thanks. In September, Oxfam did quite a bit of research to look at how global companies were really behaving during the pandemic. And what we saw is that leading up to the pandemic and even during the pandemic, many global multinational corporations are prioritizing their shareholders and executives when it comes to how they distribute their profits. In fact, we found that the top 32 most profitable corporations in the world distributed $1.3 trillion to their shareholders in the 4 years leading up to this pandemic. And since January, they paid $195 billion already in dividends. This was as of September, which equaled 95% of their profits. Now, some might say, but yes, don't those companies do a lot of corporate philanthropy? Well, actually, what we found is that the donations for COVID-19 amounted to only 0.5% of their profits. So clearly, corporate philanthropy isn't the solution that we thought it could be in terms of equalizing the playing field. We found that there were 5 ways in which corporations were contributing to inequality during the pandemic. First is the one that I've already mentioned, which is this excessive payouts, which have left both workers and governments vulnerable to the shock. Because there is no rainy day fund for these companies, so that when bad times hit for some industries, for example, like the apparel industry, they had to conduct massive layoffs. They had to look for costly bailouts, right? Which of course governments and taxpayers are paying for. And that's of course coming out of the pockets of everyday families and workers. We also saw that companies were diminishing government resources due to corporate tax avoidance. And as I mentioned already, philanthropy isn't even coming close to this. Just one example of this, 40% of recipients of the Paycheck Protection Program, that's the main stimulus bill that passed in the United States to support businesses and to try to boost the economy, had paid no tax at all in the last year. So 40% of companies receiving a bailout didn't pay any tax in the year leading up to the pandemic. So that means that taxpayers are paying for that bailout and companies aren't contributing. The third way that we've seen companies contributing is that they've been shifting their costs down the supply chain. And again, an example of this, we can look to the apparel industry, which paid 74% of its profits to their shareholders at the same time that they were canceling millions in dollars in contracts, which caused millions of people in Bangladesh to lose their jobs, where many of the workers exist in this for the apparel industry, and many of whom are now going hungry as a result. The fourth way in which we've seen companies exacerbate inequality during the pandemic is by lobbying governments to roll back regulation on environmental laws, tax, and social protections. And finally, companies have been putting their own workers at risk during the pandemic. And we see this from even as what I think Ted was alluding to, right? Workers in meat processing, essential workers, delivery workers are lacking protective equipment. They're not following good protocols that are being put out there in terms of social distancing. They're not providing any paid time off. So these workers who oftentimes may get sick with COVID or not are going to prioritize work instead of staying at home and staying safe because they don't have paid time off. They don't have paid leave, right? And they still need to feed their families. And then these workers are also, many of them not getting any kind of hazard pay, or if they did get hazard pay, it was for a very short period of time. So Oxfam has called on 4 ways in which we can change the system to create one that is more equitable. We call it the 4 Ps: redefining the purpose of a corporation, putting people at the center of business, ensuring that profits have a fair share for all stakeholders, not just executives and shareholders, and transforming how power is actually held in corporations by transforming the way in which corporations are governed. So I'd love to say more about this maybe in the final question. Thank you.
Ooh, I can't wait till we dig into your 4 Ps. And I encourage everyone who hasn't had a chance to look at the Oxfam report that Irit was talking about to take some time after the session to go take a look at that. Now, Ted, can you take us on a tour around the world through the world justice lens and look into the countries that you've been observing and tell us, are you seeing certain countries that are better equipped to ensure a just recovery than other regions or other countries? And are there any critical ingredients that you think can help determine a just recovery? So that's a twofold question.
Sure. So our rule of law index tracks rule of law performance across 128 countries, and we're seeing certain trends. So before the pandemic hit, we already had a rule of law crisis. And you saw it in particular, I mentioned fundamental rights, but also in two other factors. One was on corruption, which has been an endemic problem for decades, but is getting worse. And certainly when you have this much stimulus money coming into the economic system, there's a lot of opportunity for fraud, but also constraints on executive power and accountable governance has been another declining factor over several years. So that's the situation we find ourselves in when the pandemic hits. And that means that you would think certain things would happen as a result, but some countries have done much better than others, regardless of their regime type or their region or their income level. So it's been a much more diverse set of responses. So you have the examples that I think people know of, like South Korea or Taiwan or New Zealand, which have taken very open, very transparent approaches, inclusive of their populations, and really taking a very strong, public health, medical advice approach, and communicating clearly from the top and consistently. So that's been an important way that they have built up public trust in complying with the regulations. And they'll be in a much better position to bounce back from the crisis and achieve the Sustainable Development Goals. In other cases, advanced democracy like Sweden took a different approach and decided to have a more relaxed strategy. Obviously, other democracies like the United States, or maybe in a middle tier, Brazil and Mexico, have done terribly, frankly. And we're seeing the results in every day's rising number of cases. And some of that was for prioritizing economic concerns, downplaying the crisis for political reasons. So there's a big setback on those countries' ability to achieve the SDGs. Then you look at Africa, and there's been, many African countries have performed, I think, better than expected, in part because of the lessons learned from previous epidemics. And then, of course, there's China. China, which hid information about the virus, lied about its spread, severely curtailed the citizens' rights in the process of containing the virus, and exploited it as an opportunity to promote Chinese medical aid diplomacy, which is building on their already significant inroads into the developing world in direct competition with the West. So there is an important kind of geopolitical race here, and it has to do also with the vaccine development and distribution, with Russia jumping into that competition as well. Another factor that is worth noting is the adoption of technology. So countries that have more advanced digital system are in a better situation, as so many workers move to remote learning and interactions. We're also seeing technology playing an important and positive role in the political process, in making sure that people are able to vote, even though you have these public health concerns. And certainly we've seen that in this country with the move toward more flexible approaches to voting, and that's been quite encouraging, and may have some permanent positive effects in increasing citizen access to power. You take a country like Mexico, where a lot of the corruption, according to survey data from partners we work with, happens face-to-face between citizens and bureaucrats. Now that's not happening, and people are moving to government. It actually has a positive effect on rates of corruption in terms of public services in Mexico. In Tunisia, there's been a concern about independent media to the point where the government is putting public money toward strengthening independent media to make sure there is an ongoing process of oversight of the government's response. So in a nutshell, bottom line, the common denominator for a lot of the positive cases is public trust in government. And there's some kind of coordinated delivery of public services. There's a consistent public health message and on the ground monitoring of services, and the space allowed for civil society and journalists and auditors and watchdogs to do that kind of monitoring on the ground. All of these things work together to improve public trust, which is so important in a public health crisis.
Okay, you did not disappoint, Ted. You gave us your criteria, and you definitely gave us a tour around the world of some of the countries that have done better, some who are exploiting this, and some who are just not doing so great. We're about 30 minutes in, so I want to prompt everybody who's in the audience to go down to the Q&A section of your screen and start typing in your questions now, because I have one more round of questions for our panelists, but then I'm going to open it up so we can have some back and forth discussion. And we find that's always one of the most enriching parts of our sessions here is when we hear from the audience. So I encourage you to, put any question in there that has prompted you some extra thought during this opening set of remarks. So we'll go in order again, Carla, Irit, Ted, and tell the audience what the one or two key takeaways you think they should have as they leave this session that comes out of your work. Carla.
Great, thank you. So the two key takeaways I'd like to leave with the audience as we look at where we are now and where we need to be to ensure a just recovery are, number one, we need to look at the ecosystem at the last mile. So to ensure the safety of communities at the last mile, we really have to protect not just the facility healthcare workers, but also the community healthcare workers. And we have to work actively to think about how these ultra cold supply chain vaccines, will reach the last mile, and how accurate information about it and about the virus will be disseminated to create both trust and demand. And number two, as a global community, we should really look at not only innovations to address the problems that we have at hand from the global north, but remove the idea of the global north and the global south and look at solutions globally, and continue to look at how we can learn from our previous experiences with pandemics across the globe, and also from innovations that have come out of low and middle income countries. So now is really our ideal time, not just because of the pandemic, but because of the many movements that are happening, to not just talk about decolonizing development, to not just identify the problems in the system, but to be really humble and honest and really address those systems, those systematic issues head on. Thank you.
Irit?
Great, thanks. I think a couple main takeaways. The first is just the amount of corporate power that has really increased over the last decade, right? So just a few quick examples of this. 69 of 100 of the largest institutions in the world are not governments, they are corporations. So think about that for a minute. 69 of the 100 largest institutions are corporations. That means that there are corporations that are bigger than and have budgets that are bigger than most governments around the world. Their political influence has increased tremendously in the last decade, and this is because of the lobbying dollars they are putting into lobbying. And this speaks directly to this erosion of the rule of law that Ted is referring to, right? The reason we have an erosion of the rule of law is because of actors like corporations who are looking to, in fact, roll back regulation and look for things like corporate immunity during the pandemic, right? We saw companies actually lobbying to get corporate immunity for their actions during the pandemic. The corporate tax rate is down by over 20% around the world, here in the United States as well. So all of this is contributing to how much power they have. And I mentioned these 4 Ps, but these are not radical ideas. Even the Business Roundtable, which represents 180 of the largest U.S. companies, have indicated that they now see that shareholder primacy needs to probably transfer to stakeholder capitalism. What we need now is for that not just to be talk, but action. So their actions haven't quite met the statement yet, but they are starting to recognize that they can't just be about shareholders. These are policy choices that we have all made in terms of how we built our economy. We can build a different one. And so that's the key takeaway: corporate power, and we can build a different kind of economy to reduce that power and level the playing field.
That's terrific. So that's a lot for us to chew on. How about you, Ted? What are your 1 or 2 takeaways?
I really like all these points that are on the table here. We have a pretty bold vision here. I think, as I mentioned before, there's been an ongoing rule of law crisis, and this is not just our data, but many others that are documenting this. So I think we have to be serious about addressing that and rebuilding the democracy, rule of law, human rights infrastructure. The underpinnings of a law-bound society, a civilized society that allows us to moderate the power of corporations and other key actors, which have really, gotten it's out of balance currently, as we heard from Irit. So it's a range of things. You've got to protect civic space for citizens to, as I said before, protest, but also independent media to report and do their jobs, whistleblowers to call out when there are violations, and that includes auditors within government or in law firms. I mean, we all have a role to play when it comes to being watchdogs, and there are incentives and that we can write into laws to protect whistleblowers. And I think that's something else that we can think about. A second category is, as we see how important technology is to these responses, and societies digitize, we really need to expand more equitable access to the internet. I think that's an obvious point, but we can't say it enough, and we're not there yet, and it's going to take decades, but I think there's a lot we can do to accelerate that. And then I think another key point is the importance of collecting data so we know what impact our dollars, our tax dollars and investments are having on the people we're trying to reach. And that as we write policies, they're based on sound evidence. It's something we're calling data-driven justice. So it helps us identify local needs and allow those that are most affected to shape the response. So disaggregating that data and identifying who is affected how, and then building our response accordingly in terms of program design and implementation. We're doing our own contribution in that sense in terms of collecting data, but also not just quantitative data, but qualitative data. So we've just launched our World Justice Challenge, if I'll put in a plug here, for this current year. And actually the deadline is, we just extended it to December 16th. And this is a way for us to crowdsource solutions so that we get a more just recovery out of this pandemic. When we look at corruption issues or access to justice or fundamental rights, we want to see concrete projects that are happening in the field and identify them, recognize them, give them support, financial and otherwise, so their work can be scaled up and replicated. So I'll put a link to that in the chat.
That's great. That's great, Ted. There's a lot of important themes that we're hearing from all three of you. And so from the audience, Natalie Davis is asking you a question, Irit. I'll read it for you. Can you speak about who needs to be responsible for or involved in making those changes in the 4 Ps so that corporations can have more equitable impact? In addition to regulation, what is the role of internally driven change at these corporations, and can it be effective? And please remind everybody what the 4 Ps are in case they didn't jot them down as you were talking.
Sure. The first is around purpose. So redefining corporate purpose, putting people at the center of business, ensuring that there's a fair share of profits for all stakeholders, and then transforming power by changing how corporations are actually governed. And in terms of who's responsible, so certainly policymakers, and we've seen actually already some excellent moves by some policymakers to start this transformation for a new economic model. There have been bills out there that have been proposed by Representative Tammy Baldwin and Senator Elizabeth Warren, for example, that look to place workers on boards. Just one example of how you might transform the governance of corporations, right? By putting workers and having workers have a voice in how corporations are actually governed. There have been lots of other proposals in Elizabeth Warren's bill in relation to this issue. But it's not just policymakers, right, that can make this change. In fact, corporations do also have a role to play, and some are also getting on this bandwagon. So we see the B Corp movement become much bigger. And for those of you who aren't aware of the B Corp movement, this is a certification of companies that not only are looking to make a profit, but also have a social mission at the heart of their purpose, right? So this is starting to get at how we think about more equitable impact when it comes to corporations. And we know that even in companies that aren't B Corps, there are internal champions working in those companies who are looking to transform their companies to have more equitable impact. But unfortunately, you know, the incentives go the other way. So this can be a challenge for them. But we see workers also have a tremendous role to play, right? And the worker movement has really increased. We've seen so many workers, right, demanding more from their companies, whether it's Amazon workers asking the company to be more sustainable as it relates to climate change, or other workers that have, you know, walked out as a result of the Me Too movement. So we've seen workers now really start to engage their companies around these various inequality issues. And so they too also have a role to play, because at the end of the day, if companies can't hire workers who want to work for them, and we see that younger workers in particular don't want to work for companies that aren't equitable, that aren't sustainable. They understand they're inheriting these issues, so they're really getting engaged. Which brings me, of course, to consumers, who also have a role to play. At the end of the day, companies care about what you buy, and so they care about what you think. And so as consumers, you also can vote with your dollars. You can choose companies that have a greater equitable impact. And overall, people, right? So Ted talked a lot about this civic space. It's so critical, because at the end of the day, policymakers will respond to what we as voters want when we make our voices heard. So there is a role for all of us to play in making this change.
That's great. It's a comprehensive approach. And thanks for reminding us about the 4 Ps. I see there's people are still formulating questions to put in the Q&A. And in the meantime, I want to come back to this theme of power and influence that I've heard from all three of you. And I'm going to prompt you on this one, Carla. You've talked about a couple different big themes. You talked about information dissemination, and that's power. And you've talked about this concept of decolonization, which I know many people in the audience are well aware of, but there's also probably a number of people in the audience who don't know what that really means. Can you unpack both of those themes to the extent that you think might be useful for our audience today?
Yeah, sure. So let me start with the first one. I'll jot these down. And access to information. So the first one for decolonizing, actually, let me start with decolonizing development. So when I was referring to that, it's really looking at how we have been approaching how we think about development. So, you know, racism exists, and it exists in multiple different levels and multiple different ways. And in development, there have been different ways of approaching it, which are ways that reflect the same power dynamics that existed during colonization, right? And so there's a savior complex. There's people coming in and pushing ideas on others, as opposed to listening to the people that you're trying to serve, putting governments first and listening to them and what their needs and what their wants are, and co-developing things together. And so it's really decolonizing development is really being honest with ourselves about thinking about that. So in some of our work on transitioning well, we actually had developed this tool that was about the journey to scale with government. And in creating it with governments and with donors and with social impact organizations, people said one of the things that is exciting about the tool is not just this journey path, but also the mindset shifts that need to happen. And so looking at the power dynamics is critical to that. So that's what decolonizing development is really about. And then in terms of access to information, I mean, that is access to accurate, helpful, useful information. And so, I mean, even 27% of healthcare workers in DRC said that they would take the vaccine, for example. And why is that? Because there's a lot of misinformation that's out there. And I've heard the same thing here. Right now, I'm in Virginia, in the parking lot, in you know, many different places. People are like, I'm not going to take that vaccine. And so it's really important that that access to correct and accurate information happens, and it can happen for everyone across the board. So whether you just have, you know, a basic phone in a remote house in Malawi, or whether you're in New York City, we really need those sources of truth and access to information.
There were some other comments in the chat that maybe you can address in your wrap up section of this. In the meantime, Ted, give us more information from the World Justice Project perspective about the theme of power, influence, and information. You talked about a couple different criteria that countries need to have in place in order to have a successful and just recovery, and a lot of them are themed against this notion of information and what's out there and who's watching what that information is, and accountability, and about you know, who's in a power position and what are they doing. So can you add a little bit more color to that for all of us?
Sure. I mentioned before our rule of law index collects data from citizens and experts in 128 countries. So that's really a critical resource that really holds up a mirror for people in their own societies to see. It's not external experts that come in and tell people what's going on in their own countries. It's based on what citizens themselves are saying. And when you get that kind of more comprehensive ground up view, you can start seeing where power lies in society. So some cases, and it varies of course from country to country, but in some cases in our justice systems, for example, both civil justice and criminal justice, you can identify certain sub-factors which tell you where the problem lies. So in a place like Nigeria, there's a huge problem around pretrial detention, where hundreds and thousands of citizens are detained and not brought to trial for months or years. So that is a huge setback to a certain portion of the population and their families in terms of how they're able to have their own livelihoods in the country. So when you start breaking it down into those specific elements, or there's another question in which you ask how much influence does the government have on the justice system is in their ability to influence the outcomes or intervene directly with judges, et cetera. And some countries score well, others score very low. And so that's another telltale sign in which when push comes to shove, the government holds the upper hand and can tilt the scales of justice in their favor, which of course undermines trust and the rule of law more generally. So it's that kind of, you know, nuanced view of these specific elements of the rule of law, which is a big concept that we try to break down into these different categories. And the two big categories, and I'll stop here, are, you know, we have a set of factors that look at constraints on executive power, including delivering on fundamental rights. And then there are another set of factors that look at government's duty to produce services for their citizens. And that's where civil and criminal justice and, you know, regulatory enforcement, consumer affairs comes in. And we're seeing that over time, states are making, I'm speaking generally, are improving on the more technical aspects of governance. Like there have been improvements on access to justice and open and civil justice issues. But where we see the deterioration is where the power imbalances come in most, on the fundamental rights and corruption and executive power. So that tells us something very important about power imbalances in different societies and around the world, and the trend is going in the wrong way. And this, until that's addressed, we're not going to get to just recoveries.
Okay, I know we're running up on time now. I don't see any more questions in the Q&A section, so I'm just going to use the moderator's prerogative to share a couple things with our group. This has been a really rich discussion. There's been so much ground that we've covered here, covering such big topics, looking at it through the government angle, the last mile and the line, health workers and the private sector workers, as well as systems of government and justice. It makes me think that this really is the opportunity for all of us in the audience and all of us on this panel here to take some of these good ideas and this good work and put them into action in our own ways and think about how you can do that. There's some good resources from Oxfam and from World Justice Project and just the content here that our panelists have shared. So think about how you might follow up on that. I come at this from a grassroots international development experience myself, as I was a volunteer in the Peace Corps, a number of years ago, and I see even big agencies, U.S. government agencies like the Peace Corps, really having a chance to re-examine what its place is in the world and what it's doing. The National Peace Corps Association, which is the partner professional organization tied to that, has put out a big report calling into question some of these ideas that have been part of that system for such a long time, that they didn't use the word decolonization, but it relates to that. It relates to, who has power in making decisions around what an agency like that does. So I see it in all places, and not like anything that I think we've witnessed as a nation or as a globe since, nationally since the 1960s, when some of these big social justice movements were changing and shifting a lot of what reality looked like for all of us in the decades to come. So again, thank you, each of our panelists, to Carla, Blauvelt, to Irit, Tamir, and Ted Piccone for such a great discussion today. And I know I want to thank also the audience for participating, for adding your questions in the chat and the Q&A, for being active listeners. And also, I know that you have your agenda in the WOVA app. However, I believe our producer might have another closing remark about that before I close out, and to say thank you, one and all.
Yes, thank you. Thank you to Jen, our moderator, and all of our speakers for sharing their expertise with us today. Coming up next is just a little bit of a break, and then at 10 minutes before the hour, there is a presentation of the 2020 Global Hero Award. So you're going to want to click on your agenda in Whova and select the session to be connected at that time. Otherwise, thank you so much for joining our session. We appreciate you.
Thank you.
Thank you. Bye-bye.
Bye.